We may as well get started. I'd like to call this meeting of the U.S. Advisory Committee of Immunization Practices into session. Dr. Pickering.
Yes. Excuse me. Thank you, John, and welcome to the June 2013 ACIP meeting. The proceedings of this meeting will be accessible to people not in attendance via the World Wide Web. Welcome to all of those who can attend. As you can see by the lovely hydrangeas here, Atlanta is beautiful at this time of the year, so the people who are not here, unfortunately, will not be able to see the beauty, but we'll share a little bit with you during the course of the meeting. Several people will be with us for the duration of the meeting to help in any way that we can. Felicia Betancourt will be back at the back table at the rear of the room, as will Reed Walton and Natalie Green. So if anyone needs any help with anything, please let them know or let John or I know. We have a full agenda today and tomorrow. We will adjourn approximately 5:30 today, approximately 3:15 tomorrow. Coffee and breakfast items will be out in the hall, as will lunch for both days. Handouts of all the slides have been given to all of the ACIP members and are on the table outside of the room if anyone would like to get them. We have three things that are placed on the ACIP website after each meeting. The slides that are shown will all be placed there we try to get them up within 2 weeks. The live webcast will be posted about 4 weeks, and of course the minutes go up about 90 days after the meeting. Those go through a lot of reading and editing before they're posted. Members of the press who are interested in conducting interviews with ACIP members should see Jamelia Howard-Jones for assistance in arranging the interviews, and Jamelia is right over here. She's taking Tom Skinner's place, and welcome. At this time, we want to thank three ACIP voting members for whom this will be their last meeting. Wendy Keidel, Mark Sawyer, and Sara Rosenbaum will be rotating off the committee. Sara is not here today. Her last meeting was in February, but we will remember her anyhow. So we want to take a moment to recognize particularly Dr. Keidel and Dr. Sawyer for their incredible contributions to the ACIP over 4 years, and in Mark's case, he was having so much fun he stayed for an extra year. You were here during a real transformational time at ACIP. It's a time that we went through the grade process and establishing the grade process, which was very interesting, as you know, as one of the things that was done. And so I personally want to thank each of you for your time and commitment and the way that you had the ability to make your thoughts known in a way that was respectful of everyone on the committee and in the room. Dr. Temte is going to have a few more comments about and for each of you. Do we need to do roll call first? Yeah.
And before we do that, we just need to do a quick roll call and a review of any conflict of interest. So we'll start with Dr. Keidel.
No conflict.
No conflict.
No conflict?
No conflict.
No conflict.
Duchin, no conflict.
Rubin, no conflict.
Coin Beasley Institution receives RCT funding from, it's a clinical trial funding from Merck.
No conflicts.
Sawyer, no conflict.
Campus Outcalt, no conflict.
Bennett, no conflict.
And Temte, no conflict. Can I have the next slide, please? So starting out with Dr. Wendy Keidel. Wendy couples wisdom, knowledge, and passion, and has been just a wonderful resource for ACIP. On the slide, you see that she's been the chair of the Influenza Working Group, as well as a member of the pneumococcal vaccine work group as well. And the number of ACIP-related publications are listed here. Dr. Keidel is professor in the Department of Molecular Virology and Microbiology at Baylor College of Medicine. Her research interests include vaccine development, evaluation, with emphasis on prevention of respiratory infections and other emerging diseases. She has been involved in preclinical and clinical stages of vaccine development, and recent activities have focused on live attenuated and improved inactivated influenza vaccine or virus vaccines including H1N1 and candidate viruses or vaccines for H5, H7, and H9. She's also been very interested in exploring immunization of pregnant women to protect both the mother and the infant against influenza and pertussis. Things that you may not know about Wendy is she is an avid birder. She's a member of the Gulf Coast Bird Observatory, a generous donor to the Houston Area Audubon Society. But getting back to the point on her exploring immunization of pregnant women, if you look at her CV and her publications, you come across interesting things like this: prenatal passive transfer of maternal immunity in Asian elephants, Elephas maximus. And then also an interesting article, Perspectives on Human Microbiome Research Ethics. So Wendy brings forth this incredible background of knowledge and integrates it very beautifully into our vaccine policy work here. So thank you very much, Dr. Keidel. You have the option for rebuttal here.
Thank you both for your very kind remarks. And there was a little hook in there on elephants. And the way we got involved was that I was called by the Houston Zoo, and they said, "We were told you can make a vaccine for elephant herpes virus." And so what I realized was they knew absolutely nothing about what was going on with the elephants, and certainly vaccine development was a long way down the road before they found a lot of things out. One of the first things I suggested was that they gain some understanding of the loss of passive immunity because of the age at which the elephants start dying of this lethal infection that actually threatens the worldwide population of elephants. So it's been very interesting, as have all of my other work, particularly here at the ACIP, and I thank you all very much for having had the opportunity to participate.
Next slide, please. Dr. Rosenbaum is not here today. Her last meeting, or in February was her last meeting, but I'm sure she's here in spirit. She is the Harold and Jane Hirsch Professor of Health Law and Policy and the founding chair of the Department of Health Policy at George Washington University School for Public Health and Health Sciences. Sara has really devoted her entire professional career to issues of health justice for populations who are medically underserved as a result of race, poverty, disability, or cultural exclusion. She has provided her service to 6 presidential administrations, 15 Congresses since 1977. Best known for her work on Medicaid, the expansion of community health centers, patients' rights and managed care, civil rights and health care, and national health reform. What you may not know is between 1993 and 94, Sara worked for President Clinton directing the drafting of the Health Security Act and designing the Vaccines for Children program, which, as we all know now, offers near universal coverage of vaccines for low-income and medically underserved children. Up on the slide, she's been member in the smallpox vaccine working group, the herpes zoster vaccine working group, and in the evidence-based recommendation working group. As you know, Sara has been a tireless member who has had enormous volumes of wisdom and knowledge regarding health policy, and especially with the Affordable Care Act. Some of the interesting things in terms of her very, very long list of publications, things as diverse as U.S. health policy in the aftermath of Hurricane Katrina, vaccinating healthcare workforce, state law versus institutional requirements, and maternal care and liability. Sara is going to be greatly missed here as the consumer representative on ACIP. So a round of And next slide. Dr. Mark Sara should always be careful what you put on the internet. Dr. Sara has been chair of the hepatitis vaccine work group, chair of the pertussis work group, and members of rotavirus, general recommendations, and MMRV. Again, several publications emerging from his work on ACIP. Mark is professor of clinical pediatrics and pediatric infectious disease at the University of California, San Diego School of Medicine, and at Rady Children's Hospital. He's also medical director of the San Diego Immunization Partnership, a partnership between University of California, San Diego, and San Diego County for Health and Human Services. They exist for the purpose of improving immunization delivery in San Diego. He is an active and strong voice for pro-immunization policies and always on the lookout for cost-effective ways to improve public health, and particularly herd immunity. Now, Mark also has some interesting quotes here. When asked why he went into pediatrics, quote, "The reason I went into pediatrics is that sick adults are obnoxious," end quote. And things that you may not know about Mark is he is an avid cellist. Here's a quote: "I play cello in a community orchestra. I was never a professional, but I play in a bunch of chamber groups. And just to show how long you can stay in music, in one of my quartets, I'm the youngest by 25 years. We get together in the afternoon because the three others can't stay up too late at night. So I have to sneak out of work and go play with that particular group. It's just a delightful thing you can do forever." And one of the interesting publications I came across is Missed Opportunities to Immunize, Psychosocial and Practice Correlates. So despite the comment he made about sick adults, this kind of makes him sound like a family doc, so I'm going to check with Dr. Allaire and see if we can make him an honorary member of AAFP. Again, Dr. Sara, we have appreciated your approach here. Mark always knows when you're wrong, but he never tells you. He just very carefully and cautiously and with kindness coaxes you into the right direction. So we appreciate his efforts here. Mark has had actually a 5-year run here on ACIP, and we appreciate your service.
Well, thank you, John, for those kind and interesting remarks that you found on the internet. I would just like to reiterate Wendy's comments and those of many of my predecessors as they've left this committee, and highlight what a privilege it's been to be part of this robust system that we have in place to make sure that only the best recommendations on immunizations come forward from CDC. It's been great to meet so many wonderful people on the committee, among the liaisons, on the work groups. But most importantly, I would like to acknowledge and personally thank the CDC staff who have supported the work groups I've been on and this committee. Without them, we really couldn't do the work that we do. So I'd like to thank them very much. Thank you.
Next slide, please.
Yeah, I'll make John will permit me to make a few more comments. We have one other distinguished guest that we'd like to introduce, Dr. Lili, who is seated over here. Dr. Lili, if you'll stand, is director of the China CDC National Immunization Program. With the help of former director of CDC's Immunization Service Division, Dr. Lance Rodewald, Dr. Lili is here to learn more about the U.S. immunization program, especially how ACIP works to make evidence-based recommendations. Dr. Lee will be in Atlanta for approximately 6 months, during which time he will rotate through the different divisions that work on immunization, observing some of the ACIP work groups, and working with the ACIP secretary to secure a better understanding on the ACIP structure and function. So welcome to you. We're excited that you're here for 6 months, which are going to go very quickly. If anyone would like to meet with Dr. Lely, he will be around for the rest of the meeting. So good to have you here. We usually have, as people who come regularly to this meeting, delegates for the Pan American Health Organization attending each meeting, but a group will not be joining us this meeting. We will host the next delegation in the October ACIP meeting. We do, however, have simultaneous translation services available for Spanish-speaking guests. Please inquire with our ACIP staff at the back of the room if anyone is interested in acquiring the Spanish translations, or if you want to practice your Spanish a bit, this is a good way to do it. We want to take a moment to provide some information for our international visitors to the ACIP meeting, and this is very important. Due to the changes in the Department of Homeland Security policy, additional forms have been and will be required for each meeting at the time an international guest registers to come to the ACIP. So when our international guests register, these forms will be provided. It's critical that they be completed and submitted as soon as possible following registration. Unlike in the past, we will be unable to make any exceptions for late, missing, or unprocessed data. We're not going to be able to do that, unfortunately, anymore. So these registrations are timely. Felicia Betancourt has become an expert in this area. She's our committee management specialist. She'll be able to help with any questions and concerns that anyone may have about the process. The next ACIP meeting will take place at the CDC in October 23rd and 24th. Registration of all meeting attendees will be required. The meeting registration for the October meeting will be open after this ACIP meeting, which is a good time to register for it and get it over with. We're going to have to close the international registration a week early. So September 30th, it will close. So please, our international attendees, get registered as soon as possible, and Friday would be a perfect day to do it. With us today is the director, another special distinguished guest, is the Director General of Mexico's National Center for Child and Adolescent Health, Dr. Ignacio Villaseñor Ruiz. Dr. Villaseñor will be serving as a new liaison representative to ACIP from the Minister of Health in Mexico, and we look forward to working with you, and welcome. And has been requested by our other international visitors, Spanish-speaking visitors, we will try to speak slowly, which is very difficult for many of us. We want to thank Dr. Vesta Richardson, who served in this position for a long period of time. She left the National Ministry of Health to lead the Ministry of Health for the state of Morelos in Mexico, and we wish her the best luck in this new position. Carol Hayes, a public health consultant in the Atlanta area, will be representing the American Nurses Association. Hi, Carol. Both at this meeting and in October. Katie Brewer is taking time off, as we mentioned, to welcome a new baby. Katie has assured us that the baby will be fully immunized, and I know that'll make Dr. Baker happy, and I'm sure breastfed. Sandy Freihofer, who is here representing the American Medical Association, has assumed the additional duty today as serving as liaison to the American College of Physicians in place of Dr. Greg Poland. So Sandy, only you can do double duty for Greg. Kimberly Martin, the Director of the Immunization Policy for the Association of State and Territorial Health Officials, is here to represent the organization in place of Jose Montero. There you go, good. We will not have representatives at this meeting from the Association of Prevention, Teaching and Research, or from the National Medical Association or the Indian Health Service. We request that all cell phones be turned off, so please do that now if it's not already been done. Topics presented at ACIP meetings include open discussion with time reserved for public comment. Time for public comment pertaining to topics on the agenda has been scheduled at the end of each day. So please sign up at the desk at the back. If there are any questions, Felicia will be happy to try to answer those. And we ask that people who make public comments give 3 pieces of information. One is their name, organization if appropriate, and any conflicts of interest. We're almost done. To summarize conflicts of interest provisions applicable to ACIP, as noted in the ACIP Policies and Procedures Manual, members of the ACIP agree to forego participation in certain activities related to vaccines during their tenure on the committee. For certain other interests that potentially enhance the member's expertise while serving on the committee, CDC has issued limited conflict of interest waivers. Members who conduct vaccine clinical trials or serve on data safety monitoring boards may present to the committee on matters related to those vaccines. However, they are prohibited from participating in deliberations or committee votes on issues related to these vaccines. Regarding other vaccines of the affected company, a member may participate in discussions with a proviso that he or she abstain on all votes related to the vaccines of that company. Detailed instructions for submission of names for potential candidates are on the slide that's on the screen. People that want to serve as ACIP members, the membership deadline is November, no later than November 15th of this year for the 4-year term beginning in July. So if you would like to become an ACIP member or know good people who you think would be interested, please let them know so the process can be begun. One last comment. At every meeting, we provide an update on the status of ACIP recommendations for this very busy committee, as we saw from the publications that were accrued through Mark and Wendy and Sarah's tenure. A listing of these recommendations that have been published are on the screen. Links to these recommendations and schedules can be found on the APIC website. And since the last meeting, there have been publications on Tdap in pregnant women, prevention and control of meningococcal disease, prevention and control of influenza with vaccines, and then prevention of measles, rubella, congenital rubella syndrome, and mumps, a summary of the ACIP recommendations. With that, Dr. Temte, you've already done roll call on conflicts of interest, and I understand you have a special presentation.
Just a few quick comments here. So next slide. In April, I had the pleasure of being in Beijing for an exchange with my department and a general practice department. But Dr. Rodewald helped to set up an opportunity to talk on implementation of GRADE into vaccine recommendations to the Chinese CDC. I believe you can see Dr. Lili up in the front row taking copious notes. The presentation was enthusiastically received, and China is well on the way into incorporating GRADE into vaccine recommendations, starting out with a new recommendation for varicella vaccine. Next slide. And again, if you recognize Dr. Rodewald in the front row there, Dr. Lili in the middle of the back row, and other members of the immunization program of China. But just a wonderful exchange that we had, an enthusiastic reception of an evidence-based process into that country. Next slide. There are some notable anniversaries for all of us to be aware of. As I mentioned with Sara Rosenbaum, we are now into 20 years of the Vaccine for Children program. The birth of VSC was created by the Omnibus Budget Reconciliation Act of 1993 and has been operating ever since. The National Vaccine Advisory Committee came into play 25 years ago. Dr. Ornstein could not be here today, but he is now chair of the VanVac and was also present at the very first meeting 25 years ago on June 8th, 1988. 50 years ago, the 317 program came into play under the Immunization Assistance Act, passed in 1962 and implemented in 63. And this was a means for the federal government to begin to provide some support to state and community level immunization programs. Next slide. As Larry had mentioned, we have just published June 14th the updated Prevention of Measles, Rubella, Congenital Rubella Syndrome, and Mumps 2013. But of note is a couple anniversaries here. So next slide, please. This is the 50th anniversary of the mumps vaccine culture. Maurice Hillman first collected and cultured mumps virus from his daughter, Gerald Lynn. in a clear violation of HIPAA regulations, he named the strain after his daughter, and this is a strain that continues to be in use today. And you can see by the graphic on the lower left-hand corner the marked reduction in mumps in this country. And then finally, next slide. This is the 50th anniversary of the measles vaccine, licensed in 1963, and has prevented an incredible number of illnesses and deaths worldwide. When I got started with vaccine issues back in about 2000, we were still at about 1 million deaths a year of children across the world. This has dropped down to, I believe, 158,000 last year and continues to decline. So just so everyone is aware that this has been an impressive implementation of wonderful technology that has been just life-saving across the globe. So many thanks for everybody who has been involved with measles vaccine development, marketing, testing, and distribution. With that, Dr. Pickering.
Yeah, I'd just like to say one thing. We ring this bell at every meeting, and I'd just like to recognize the saying on this bell says, "May the ACIP recommendations always ring clear." This was donated by Dr. Sam Katz in October of 1993. Dr. Katz was the co-discoverer, of course, of the vaccine with Dr. Hilleman. And Sam, if you're listening to us, you're still with us in spirit. Thank you for all the work that you've done. And And the last thing before we start is I received yesterday something that's absolutely wonderful. It's the Immunization Resources for Obstetricians and Gynecologists, a comprehensive toolkit. And Laura Riley, if you wouldn't mind just saying a few comments about this, we will put the website up where this can be obtained for people. And to many of us, and I know Carol will be extremely happy about this, the continued and important immunization of pregnant women is being stressed by OBGYN. And Laura, if you could comment.
Thank you. Thanks for the opportunity. So this is the website, immunizationforwomen.org, and it is available to anybody and everybody who needs it. The toolkit that Dr. Pickering has nicely shown just came out this month. It's incredibly comprehensive. It's our effort to continue to educate obstetrician gynecologists about what needs to be done both in pregnancy as well as non-pregnant adult women. Trying to get immunization into standard OBGYN practice. As many of you in this room know, that is an uphill battle, but I think we're slowly but surely winning the battle, at least with education, and so this is our huge effort. If you go on to the first page of the website, you'll see this toolkit. All of the information in it is available online. One of the major pieces of the information, in addition to our committee opinions, which are, which have been out there for a long time, there's a nice book on coding, which is particularly important for OBGYNs as they put it into their practices. And it's, there's laminated cards, there's tear-off sheets that can be used in the office. So if you know of any OBGYN practices out there still not doing what needs to be done, at least you could mention to them to go ahead and look on the ACOG website, their own website, and look under immunizationforwomen.org. And just one last thing, a lot of the information that's on there, we have information on all vaccines, but one other issue is obviously the Tdap recommendations have now come out. They're on the website. In addition, we have frequently asked questions, tear-off pads, which will be available at the end of July. So those were fast-tracked, and so physicians can put them in their offices, just put them out and let patients tear them off and then ask questions about it and get their vaccines. So thank you to everybody on the ACOG Immunization Committee who worked very hard to put all of this information together. So we're still working at it. Thank you.
Thank you, Dr. Riley. I'd like to move on with the agency updates and CDC. Dr. Schuckett.
Thanks. The public health community here in the United States and around the world are dealing with several vaccine-preventable disease outbreaks. Just want to mention 3. There's a the largest outbreak of measles in the United States since we eliminated indigenous spread is occurring now in part of New York City. The health department is managing this, but it's occurring in a religious community that doesn't vaccinate regularly. There is also an outbreak of hepatitis A affecting people who live in Western states. It's been linked to a product of a blend of berries and pomegranate mix that was distributed by Costco, and the public health folks in the 8 states that have received the product are managing vaccination of exposed people. The third outbreak is particularly unfortunate and is affecting the Horn of Africa with a resurgence of polio in Somalia and refugee camps in Kenya. So large-scale vaccination is happening there. We still are closer than ever to polio eradication. This is a setback, but it's being aggressively responded to. On a more positive note, I want to announce that the IT system for ordering vaccines through the Vaccines for Children program, or 317 program, which we call VTRAX, has been successfully rolled out to all of the state and city grantees as of May 2013. 73% of providers in the country are on the system now, either directly or through their registries interacting with the VTRAX system at the state health department. Our target is to get 85% of providers on the system by the end of this year, and we seem to be well on the way to doing that. This has been a multi-year effort with huge collaboration between state and local public health and the IT experts here in Atlanta, and I want to thank everybody who's gotten us so far.
Thank you. Moving on to CMS and Ms. Hens.
Hi, thank you for the opportunity to make an update, this morning. We are actively, thanks. We are actively working on implementation of the provisions of the Affordable Care Act related to immunizations. 3 primary provisions are the primary care payment increase, which is also known as Section 1202. Every state, with the exception of Alaska, which already pays at the Medicare rate, submitted an application before the March 31st deadline, and we're in the process of reviewing those. We're close to approving 40 of them, and the last group we're working hard to get approved as quickly as possible. That means that providers will soon be able to receive that increase in payment for all primary care services, as well as for the vaccine administration, or for the vaccine administration for vaccines. Also, the Section 4106 of the Affordable Care Act allows states to receive additional federal funds if states choose to cover all USPSTF AB recommended services, as well as all ACIP recommended vaccines in their administration for adults. Currently, those services are optional services. If states choose to cover all those services and have no cost sharing, they can receive an additional 1% of federal funds for those services. We have 4 states that have submitted applications, and we have approved 1 of those. And we're hoping that as time goes by, we'll receive applications from many other states. We're also hopefully very close to publishing the final rule that will define the benefit package for the Medicaid expansion populations that will go into effect on January 1st. And that will include emphasis on prevention. So there will be much more information on that coming out very soon.
Thank you. Department of Defense, and Dr. Geeby.
Yes, good morning. Jesse Geib here. DOD has no new updates today, but on behalf of DOD, I would like to thank CDC and ACIP for their ongoing great collaborative communication with DOD for our immunization programs, as we continually reassess our programs to ensure that they're closely aligned with that of CDC and ACIP. An example would be DOD's recent guidance update and publication by the Office of the Assistant Secretary of Defense for Health Affairs on Japanese encephalitis vaccine this past May. Thanks very much.
Thank you. Department of Veterans Affairs and Dr. Kinzinger.
Good morning. I'd like to just mention several things that we're doing in collaboration with our federal partners around electronic health records and immunizations. We're continuing to work with our partners in the DoD to develop a joint immunization module for our 2 electronic health records. That work is ongoing. It'll probably be ongoing for a while yet, but it'll be a wonderful tool when it's done. As a result of the adult immunization meetings last month, we've developed some, are starting to develop some relationships to work with the CDC on seeing if we can find ways for VA providers to access the non-VA immunization registries in the states. So we're trying to see if we can work that out. And we're also working closely with the Indian Health Service on sharing ideas about decision support tools for our electronic records. So lots of good work going on around electronic health records.
Thank you. Dr. Sun for FDA.
Good morning, everybody. Just a couple of noteworthy things since the last meeting. As far as approvals, something you'll hear more about later on, the approval of the Japanese encephalitis vaccine Ixiaro for the pediatric indication from 2 months to 17 years old. Prior to that, there had been no, due to the expiration of JEVAX, there had been no pediatric vaccines licensed for the pediatric population, so this fulfills a unmet need. The other notable approval since the last meeting is the approval of Fluzone QIV, a quadrivalent influenza vaccine that is the 3rd licensed vaccine, QIV vaccine in the United States. This one has an age indication from 6 months and above. And then lastly, again, something that will be discussed tomorrow. FDA conducted a post-marketing study of rotavirus vaccines in the PRISM study, which will be discussed tomorrow. This is notable in that this is the first instance in which the authority given to FDA by the FDA Amendment Act of 2007, which that the agency can require a new safety information to be placed in the package insert. Thank you.
Thank you. Dr. Caserta from HRSA.
Thank you, sir. The Advisory Commission for Childhood Vaccines met 2 weeks ago and produced recommendations for the Secretary. Recommendations of interest would be extending the statute of limitations up to 8 years with no opt-out period during that extended period of time. The ACCV also recommended that the Secretary work to expand coverage under the VICP to include vaccines that are routinely recommended for categories other than children, such as pregnant women, and are not specifically recommended for routine administration to children. The ACCV also recommended to the Secretary that she should support eligibility to pursue compensation for injuries sustained by a live-born infant whose mother received the vaccine while the infant is in utero. In order to further her support, ACCV recommended that the Secretary take whatever steps are necessary and within her legal authority to accomplish this. In addition, we're very close to publishing our rotavirus table regulation. We received a waiver from OMB, so it doesn't need to go through OMB clearance, and that should be published within the next few weeks.
Thank you. And then finally, NIH and Dr. Gorman.
Good morning. NIH, like many of the other organizations in the federal government, is preparing for the H7N9 in terms of developing, testing, and providing a vaccine if and when this becomes an epidemic. In terms of responding to future flu epidemics, we are also working hard at this particular time at multiple different manufacturing techniques to reduce our reliance on egg-based technology. In a public-private partnership, India has announced positive results from their rotavirus, or their rotavirus vaccine called Rotavax, and that's a partnership of NIH, DBT, Bharat Biotechnical Society, Stanford University School of Medicine, the Bill and Melinda Gates Foundation, and the Research Council of Norway. And this will increase our vaccine supply for that particularly important vaccine in that country. On a very small note, the NIAID has announced the award of a leadership group in antimicrobial resistance, and that will be meeting for the first time today. While I'm here, they'll be meeting at NIH to start that particular effort. Thank you.
And thank you very much. I guess, Dr. Pickering, one item here.
Yeah. For the record, we have a quorum for this meeting of 13 voting members and 7 ex officio non-voting members. Thank you, John.